Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Dr. Rosa is well-published and a contributing author to imaging textbooks. Dr. Rosa's passion is to help prevent early sickness and death using a simple, underutilized biomarker seen on MRIs called visceral fat. Dr. Rosa, welcome to the Open Your Eyes podcast with Dr. Kerry Gelb.
Thank you so much for having me here. Good morning, everyone. We are here to share information regarding visceral fat, how to detect it, how to prevent it, how to reverse it, and build a functional, independent body and an optimal life. Yes.
I really want to thank you for creating awareness of this powerful biomarker that can help people. One of my passions is early diagnosis and to see who's really at risk before they even get disease, to see who's at risk and help the patient, teach them what they could do to reverse disease. Now, in the eye, we have early biomarkers such as microaneurysms. And in fact, I wrote a paper on that in 2016 with a retina specialist and a cardiologist. And we're getting awareness out. So when we see these biomarkers in the eye, even before the blood tests are abnormal, many times, we could help people change their diet, change their lifestyle, so they don't wind up with insulin resistance or the path of diabetes, the spectrum. And I see what you're doing by diagnosing visceral fat, something very similar and maybe even better.
So I have learned about visceral fat with my friend and doctor, my mentor, Dr. Sean O'Mara. He is a health optimizing physician, and he's in Minnesota and Florida as well. And we used to work together in Minnesota, and that's when he introduced me to visceral fat. He has done a research with patients that demonstrated visceral fat on MRI and also fat in the muscles, the myosteatosis. And he was able to show that by reversing visceral fat due to simple strategies and sprinting as well, due to reversing visceral fat, the inflammation in the body would decrease and all the things that they were evaluating together were improving. So he explained to me, he showed me the results, he showed me the research, and that's when I got interested in, together with him, start working in bringing awakening and awareness towards visceral fat, because visceral fat is, if you Google or you go to Chat GPT and you Google whatever you are feeling together with visceral fat, you're going to be surprised that everything that is causing pain and sickness and disturbing your health and your life has visceral fat as an important foundation, a root cause analysis. You feel something, you go there, Google or Chat GPT. Together with visceral fat, you're going to see how visceral fat is dangerous and detrimental to your body. And that's when I started describing it in my reports, because we do not learn that in medical school. It's not in the medical school curriculum. And I have done medical school in Brazil. I had done my radiology residency in Brazil, repeated this here in the United States. So I had 2 trainings and a one body fellowship training And I have never heard about visceral fat before I have talked to Sean. So he brought me the awakening, the awareness, and I am really grateful to be a voice now to bring health.
And not only are you a medical doctor, but you have a PhD and you did research in pancreatic cancer.
I did.
And
I did my
tell us a little bit about that research that you did.
So my PhD in Brazil was regarding comparing intraoperative ultrasound with other diagnostic imaging modalities such as CT and MRI in detecting small pancreatic tumors called insulinomas. And it's kind of interesting because right now I am dealing with insulin resistance and working towards reversing visceral fat, which is so connected to insulin. And at that time, I was studying pancreatic cancers called insulinomas. So showing that when you do an intraoperative ultrasound, you are able to detect the lesion way better than when you do CT or MRI. You are able to detect more than one lesions that might have been missed on the imaging studies prior to surgery, and also the vascular relations of the tumor and the biliary relations of the tumor, like leading to more safe removal of the tumor without damaging vessels and without damaging the biliary tree.
It seems like pancreatic cancer is increasing, and as we know, it's almost a death sentence in most people. Do you think by being able to diagnose if somebody has visceral fat and reversing it, we could lower the risk of people getting pancreatic cancer?
Definitely. I have seen different papers showing the correlation between visceral fat and pancreatic cancers, adenocarcinomas, which are the worst cases of pancreatic cancers. And they grow silently. That's why when you have the diagnosis, usually it's stage 4 and bad, and it's really hard to reverse, right? You cannot do a treatment. It's usually palliative treatment. So yes, visceral fat has been associated with increased incidence of pancreatic cancer. And there are studies showing that the increase in the waist-hip circumference ratio it's related to pancreatic cancers as well. And visceral fat, if you look at in your researches, visceral fat and cancer, you are going to see that visceral fat is correlated really like very directly and exponentially with cancers like prostate, colorectal cancer, breast cancer, lymphoma, leukemia, kidney, thyroid. In fact, for women postmenopausal, that visceral fat increases, and that fat leads to producing aromatase and changing the estrogen in your body, the production of estrogen in your body. Visceral fat is definitely related to breast cancer and endometrial cancer. So yes, visceral fat is carcinogenic. Visceral fat secretes a molecule called fibrogen growth factor 2, and it is one of the factors that lead to transforming a normal cell to a cancerous cell.
So since we're talking so much about visceral fat, I want to go over the different types of fat, but explain what is visceral fat, and then we'll go over the different subcutaneous fats and the different type of the fat that people have.
So visceral fat is the fat we have in our abdomen, and it's the fat that surrounds the organs in our abdomen. And initially, visceral fat is a defense mechanism of our body. So visceral fat is like you are over consuming carbs, you are overeating, you are with a grade of overnutrition. So this hyperload of carbs, the body has to do something to keep what we call homeostasis, which is the equilibrium of our bodies, right? So when you are overloading yourself with carbs, the body grabs the carbs and the fats and starts storing it. And the way it stores it, it's by increasing the number of your fat cells, your adipocytes. To increase the size, the first step is increasing the size, which is called hypertrophy. So it increases the size until it can't increase anymore. And that's when the fat cell is usually like 100 or 200 times bigger than the normal volume. And when it gets to this limit, then it starts producing new fat cells. When it starts producing new fat cells, or even when it's increasing in size, it breaks the equilibrium, so it breaks the homeostasis and starts generating inflammation. Because the fat cell has immune cells together with it, like every other cell in our body, to protect us, right? But when the fat cells are dysregulated, are malfunctioning, what happens is that it will increase and ignite a cascade of inflammation in our body because of the activation of these immune cells. And that's when visceral fat produces chronic inflammation in our body, and we are exposed to this chronic inflammation continuously, and it's producing factors like interleucin 1, interleucin 6, macrophages, monocytes, neutrophils, fibroblasts, and tumor necrosis factor alpha. All these are like increasing exponentially in your body because of the presence of visceral fat, and one feeds the other. Visceral fat releases that, and this inflammation increases visceral fat and releases inflammation, and it's a vicious cycle in your body. And recently there was a study proving that visceral fat also releases cortisol. The fat cells from the visceral fat also releases cortisol, which is really bad because it's the stress hormone. So it's one feeding the other in a snowball effect. And that inflammation is the inflammation that is going to bring damaging to our bodies from head to toe. Like visceral fat is bad for cardiovascular disease, such as cardiac attacks and microvascular disease and angina and heart failure, atrial fibrillation. Like we are seeing lots of cases of atrial fibrillation nowadays. And there are studies showing that by reversing visceral fat, you can improve or even resolve your atrial fibrillation, because it's the fat surrounding your heart and the fat like in your heart itself as well. And also like small vessel ischemic disease in your brain and strokes and the diabetes type 2, the pre-diabetes, the fat in your liver, the fat in your pancreas, dementia, Alzheimer, which is now called diabetes mellitus type 3. So visceral fat attacks all the arteries in your bodies, the arteries that go to your brain, the arteries in your neck, the arteries in your chest, the arteries that go to your kidneys, the arteries that goes to your eyes, like you see so well, and hypertension, the arteries that go to your legs, like giving you, the person is not, which is peripheral arterial disease. So you cannot walk 2 blocks or a block that you have to stop because you have this unbearable pain. And it's because your vessels are so filled with calcium that the lumen is so narrow that it doesn't provide vascularity for your legs and for your body. You could have ischemia in your bowels and everything like that.
How do we know when a study is something we could kind of say, yeah, this makes some sense to us?
Well, it's just like you mentioned, Carrie. You have to look at the source and who's paying for it. I always look at the source of the publication that it's coming from. Is it a reputable publication? And where's the funding coming from? And like you said, so much of the industry is funding these studies that you have to be skeptical. And again, like you said, when the findings don't make any sense, then you have to look for other sources. Now, science is ever evolving. You know, that's why even during something like the COVID, when they said, no, this is the science is settled. Science is never, ever settled. My old partner in New York and my mentor had a great expression, which I've taken out. I always give him credit for it, but I use it all the time. He says, you know, up to half of what I tell you might turn out to be wrong one day. I just don't know which half. And, you know, like even I've been out of medical school for 25 years. And a lot of what I learned as gospel and just the truth in medical school, well, the protocols have changed. And it says, you know, it turns out that that's not true. And you have to constantly be evolving. And, you know, science is never settled. There is no consensus in science. You have to be open-minded and accept the results no matter what they are. So that was one of the things that bothered me, and it still bothers me, because, you know, science is never settled, and you hear that in the news all the time.
You know, it's funny that you bring that up. You know, as an optometrist, patients talk to me and they'll talk to me about their internist, they'll talk to me about their cardiologist. And because of the pandemic and how COVID was treated, a lot of patients have lost confidence in a lot of doctors. And I was wondering if you could comment on that.
And this is something that I'm actually kind of passionate about too. I think one of the greatest tragedies and one of the greatest things that have gone on, other than people losing their lives and the actual sickness, was the erosion of faith in public health and the trust in public health, because the authorities that we trusted in the past, they lied to us. They lied to me, they lied to you, they lied to the public because they didn't think we could handle the truth. And that really, I think, is going to have ripple effects for a very, very long time. They basically came between patients and their doctors. To me, there's nothing more sacred than the doctor-patient relationship. It's a very, very unique relationship, and there's really nothing else like it. Because if you think about it, a doctor and a patient, it's unique because I have to care. I have the fiduciary responsibility to care about that patient, but I'm a stranger. So that relationship, it goes above and beyond, doing a service for somebody. I genuinely care about that person's well-being and doing the right thing. But we're not friends. We're not family. It's a different kind of a relationship, and that's sacred. And to make medicine work properly, that relationship has to be intact, and that has to be the foundation that everything else is built on. And what happened in the last couple of years was an erosion to that foundation, because now people have taken it upon themselves. You know what? Now I don't trust anybody. Whether even people like me and you, who were trying to do the right things, trying to get the right information. I remember, early on in COVID, because I kind of broke with the orthodoxy early and said, wait, there's something wrong going on here. I don't trust Fauci anymore. I don't trust the FDA anymore. And then when a lot of medicine was still kind of going along with the orthodoxy, and thankfully, I think that's really changing now. But early on, and really up until fairly recently, the orthodoxy was in control. And if you broke with that, you ran a lot of risks. And so patients would sometimes say to me, but other doctors are telling me, something different than you're telling me. You're telling me that I'm young and healthy. I really don't need to do anything else. They're telling me I should do this, that, and the other thing. Why is it different? And I came up with a great analogy to describe why I had different opinions. And I said, the kind of doctor I am, I'm a maitre d', I'm a waiter. I'm out here working the room. I'm serving the food. I'm serving the public. I'm not a chef, meaning I'm not a research scientist. I'm not in the lab with the test tubes. I'm not in the kitchen making the food. So most of my career, I trusted the chefs. You guys cook the food. Food is good. I'll serve the food. So that means like the FDA, the professional organizations, they vetted a drug, they tested a product. Even though they made mistakes sometimes, I really felt that their heart was in the right place. And sometimes they got it wrong, fine. But I don't believe that anymore. I don't trust the chefs anymore. I would tell them, your other doctors are still trusting the chefs. I don't trust the chefs anymore. Now I have to do my own cooking, meaning I have to do the research. I have to look at the data myself, because I don't trust what comes out of the FDA, the CDC, the professional organizations, and certainly not big pharma, because it's all corrupted by the money now. So now I have to go to bed at night put my head on the pillow, knowing that I gave my patients the best advice that I could based on whatever I know. So that means I have to go out and seek the truth. I have to seek the right information myself.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
Dr. Heather Sanderson, thank you for joining me today on Wellness 1280, Open Your Eyes Radio with Dr. Kerry Gelb.
It's a pleasure to be here. Thank you for having me.
Thank you, Dr. Sanderson. I'm very interested in your work. I'm very interested in the work of Dr. Bredesen. As an optometrist, I see a lot of patients that are getting Alzheimer's disease. We use technology called OCT, which can sometimes pick up non-specific signs of Alzheimer's. we'll see thinning of the macula on the OCT. It's called ocular coherent tomography, and it uses waves, light waves, to be able to slice the retina into different sections. And we could start to see thinning of the choroidal vessels, which are the little blood vessels inside the choroid of the eye, which shows that vessels are dropping out. If they're starting to drop out in the eye, they could most likely, because the eye and the brain are similar, they could be dropping out in the brain. And the nerves, because it's a combination of a nerve disease, a vascular disease, and we're going to talk about the different causes, possible causes of dementia. And we could see it in the eye very early. But I want to ask you, is it true that we can now start to stop or even possibly reverse dementia or Alzheimer's?
You know, I know it's a bold statement. My book is called Reversing Alzheimer's. And I talked to the publisher when we were discussing the title, and it was like, can we do this? Can we say this? And the reason I feel so confident is because I've seen it happen in my patients and my coaching clients and in our residents at Marama over and over and over again. It doesn't just happen occasionally, it happens regularly. And to your point, early detection using the eyes, the nose, ears, right? Our sense organs are this extension of our central nervous system, or an extension of our brain. And when we can detect this disease process early on, we have much more confidence that we can get a reversal of the disease process, of the pathophysiological process leading to neurodegeneration. If we wait until the end stage, although we've seen miracles happen many times, it's definitely not guaranteed. There's a ton of suffering that happens along that path leading towards significant dementia. That why not? Why not get started earlier? I think most people have heard the refrain over and over again. There's nothing you can do for Alzheimer's or dementia. They might have even heard this from a well-meaning neurologist. But we know now through Dr. Bredeson's work and much of the research that's being done on lifestyle interventions that there is almost an overwhelming amount that we can do to support neurocognitive function as we age. And so I love this idea of sort of combining this early detection that we can get through looking into the eyes, through there are smell tests that are being proposed to use as an inexpensive way to pick up early Alzheimer's. And then we also know that the ears, one of the modifiable risk factors when it comes to dementia is supporting hearing. If you're going through hearing loss, if you're experiencing hearing loss, getting hearing aids and treating that reduces your risk of developing dementia over time.
You know, you've done a groundbreaking study which shows that we could reverse dementia or slow it down by close to 75%. Dr. Bredesen in the 80s, 84%. Could you review those two studies with me?
Yes, and absolutely. I'm also going to add one more that came out in June of 2024. So in 2022, Dr. Bredesen and his team, led by Kat Toops, they published a clinical trial that it included 25 participants who they took through a 9-month intervention. This was an aggressive intervention, right? 9 months, they threw everything at it: diet, lifestyle. They did all of the functional medicine precision-based testing, looking for toxins, infections, nutrient imbalances, gut issues, you name it. They looked and they corrected it wherever they could. And what they saw, they took patients who had MoCA scores down to 19. So the MoCA is the Montreal Cognitive Assessment, and it's a simple tool that's free. The PDF is available online. It's easy to administer. A tech can do it. You don't need a doctor or nurse to do it.
And it's a memory test.
It's a memory test. Many people will have heard of this, right? There are presidents who refer to it and say they got perfect scores. And what you do is you identify zoo animals, you draw a clock, copy a cube, identify where you are in time and space, and it's out of 30. So perfect score is 30, normal is 26 and above. They took participants who have had cognitive impairment with MoCA scores down to 19. So again, 25 participants, 9-month intervention, Dr. Bredeson's approach, with MoCA scores down to 19, and 84% of participants improved their cognitive function. So for most people with declining cognition, what we expect is a 3-point drop in the MoCA score per year, per 12 months. That's 2 to 3 points is average decline. What they saw was an improvement. So it went in the other direction in just 9 months. A year later, I was able to publish, we were doing these studies at the same time on parallel tracks. I actually didn't know Dr. Bredesen when I got funding for my trial and when we got IRB approved and we were able to get started. And so I didn't have a dialogue with him around it, but I happened to essentially design a very, very similar trial based on my clinical experience, putting his information and his training to work in my office. So we took 23 participants through a 6-month intervention, and we took participants with MoCA scores between 12 and 23. So again, they took participants with MoCA scores down to 19. As you get closer to 0, that's worsening cognitive impairment. And normal is 26 and above, perfect is 30. So our participants have MoCA scores of 12 to 23, so more advanced dementia. And we included participants who had diagnoses of Alzheimer's. And what we saw there was with a shorter intervention, just 6 months, we saw that 74% of them improved. And we had statistically significant increases in the mean cognitive scores, both on Cambridge Brain Sciences and the MoCA testing across all of our participants, and also statistically significant improvements in quality of life and sleep.
And so what did they see exactly? Was memory getting a lot better? Was it getting a little bit better? What were we seeing? Was it, learning, was learning easier? Could they do simple tasks better?
Precisely, all of the above. So we saw statistically significant improvements in overall composite cognition, memory specifically, but also improvements in verbal ability, reasoning, focus, and other cognitive tests that we did. Across the board, we saw improvements. Not all were statistically significant, but across the board, we saw improvements in quality of life and their ability to take on day-to-day tasks. Now, there's a third study that just came out in June of 2023. It was done by Dr. Dean Ornish, and this was a lifestyle intervention, and it was just 5 months, but it was a randomized controlled trial. So they compared one intervention group to a control group, and what they saw was, again, when we apply these lifestyle interventions to people who already have mild cognitive impairment or early dementia due to Alzheimer's disease, we see improvements in their cognitive function.
And you have done some great work to help people in memory care and extended memory care. Can you talk a little bit about your facility and how we could ask people around the country to join in and look at Dr. Bredeson's work and your work to help people who need memory care?
Yeah, so our goal is to turn memory care into memory recovery and help people who are in independent living or maybe even assisted living who kind of are looking at that potential of going into memory care, that there might be an alternative. There might be another way to do this. And what we've done at Marama is created an immersive experience in Dr. Bredeson's approach. And our goal is to get more people access to this by partnering with people who already own and operate existing senior living facilities across the country. No one wants to go into memory care. No one wants to go into assisted living, right? If you ask someone, usually people who are in their 40s, 50s, 60s, they're saying, take me out in the back and shoot me, right? Before you put me in a home like that, I would rather do anything else. I don't want to have to pay for it. I don't want to be a burden on my family. I don't want other people to I don't want to lose my dignity in that way. And so an opportunity to go a different direction and go towards memory recovery is so exciting. And what we've seen is that we can get those outcomes, particularly when people move in before they actually need full memory care. But it is really on these foundations of 4 pillars at Marama that we employ there. And this is, again, this immersive experience in Dr. Bredeson's approach, where we have an organic ketogenic diet, so very low in processed foods, almost no processed foods, and very low in carbohydrates, so that we start burning fat for fuel in the brain. This allows the brain to get more energy, more resource, so that we can do those creative tasks, execute those plans that we have, and reason and remember the names of our loved ones. So organic ketogenic diet is one.
Tell me what's on the ketogenic diet? What does that involve? Does that mean people have to eat fat all day long, or are they eating coconut oil all day long? What does it involve?
Yeah, there was a recent trial that told us that having MCT or medium chain triglycerides or the coconut oil that MCT is found in can improve cognitive function just using 1 to 2 tablespoons a day. So it's something that even without getting into ketosis and reducing your carbohydrates, you can get started by just taking 1 or 2 tablespoons of coconut oil each day. And that can help in multiple ways, but primarily by sending those medium chain triglycerides into the system, which become beta hydroxybutyrate, or the form of ketones that our brain likes to burn as fuel. So again, we can use that instead of carbohydrates, sugar, glucose, those can be used interchangeably and burned as fuel. As we age, all of us end up with some sort of insulin resistance and difficulty turning glucose into ATP, or that fuel our cells run on. But our bodies and our brains are just so divinely designed and incredible to me. We are like hybrid engines. We can just flip the switch. And if we restrict carbohydrates enough, we can start burning ketones for fuel. This creates less oxidative stress. It's actually detoxifying. It reduces inflammation. And we're more efficient at burning it and turning it into ATP. So we actually have more resource available. And so we see that in patients, they'll go from not remembering their grandchildren's names to 3-4 days later, knowing all of their names and birthdays. I mean, it's just miraculous. It's pretty amazing.
What should people cook with? What kind of oil?
So coconut oil, avocado oil on higher heat, olive oil, the high polyphenol olive oil, if you are like putting on salad dressings and things like that. Butter and ghee are also okay on higher heat. And those are my favorites.
Dr. Sidoroff, welcome to Wellness 1280 on Open Your Eyes Radio with Dr. Kerry Gelb.
Well, thank you, Dr. Gelb. It's a pleasure to be here. I'm looking forward to our conversation.
Dr. Sidoroff, I read your book, and it's a book everybody should have. It's 400 pages, but you don't have to read the whole thing at one time. You can read bits and pieces. And I've taken bits and pieces out, and toward the end of the book, it was pillar 2, I believe, is having a better relationship with others. You talked about the Gottman ratio for a good relationship. And I've been fascinated with that Gottman ratio. Can you explain to the audience the Gottman ratio, how I could get along better with my wife, and my producer, Melissa, could get along better with her husband, my friend Joel?
Sure, and it's a good place as any to start. And John Gottman is a psychologist at the University of Washington, and he spent years studying couples. And he actually has a laboratory that is an apartment, and couples would go there and spend a few days there with cameras in every room. So he's able to monitor their interactions. And one of the primary findings that he made was that healthy relationships have a ratio of 20-to-1 positive to negative interactions. And when that ratio drops down to about 5-to-1, the relationship is in trouble. And so I've taken that finding and I've applied it in my own work, first to our relationship with ourselves, and then to our relationship with others as he does. And so I ask people to monitor their internal dialogue. How do they talk to themselves, and ask them to monitor and determine, are they at 20-to-1 positive to negative, or perhaps 5-to-1? Well, what I find with many of us, in fact, our ratios are more 1-to-5 positive to negative. In other words, a lot of us have a relationship with ourselves in which we do not treat ourselves as good as we should be. And then I apply it in pillar number 2 to relationship with others, so that we start to notice what is the quality of our relationships. So the goal is to spend more time with people in which we have this 20-to-1 relationship, and discriminate and spend less time with people who can be judgmental, critical, because our environment is very important in terms of whether we stay in a place of resilience and balance. If we are in relationships where we have to be on guard, we have to worry about what the other person is thinking, that's going to trigger our stress response. On the other hand, if we're in relationships where we feel safe and comfortable, we can let down our guard. And in those relationships, we get what I refer to as emotional nourishment. And so in pillar 2, you want to be making sure you're in relationships, in environments in which you are getting emotional nourishment and not having to put your guard up as much as possible.
You know, since I've read your book, I've been trying to practice that with my wife. And I've been saying very positive things and trying to do positive things. And I have to tell you, it really works. It's really helped my relationship with my wife. And I've used it with my kids, and I've used it with my employees as well. And I think it helps with everything. Now, you brought up an interesting point. There are certain people that are negative Normans. whenever you're around them, they're so negative. Do you have as a psychologist, somebody who's thought about this for many, many years, why are some people so negative?
Well, that's a very good question. And our style develops out of our lessons of childhood. And so we learn how to be in the world based on our little home environment growing up. We don't, as a child, we don't go out and sample hundreds of families to see what's the best way to be. We assume that that small world that we grow up in is representative of the larger world, even though it isn't. And so unconsciously, we adapt to the lessons of our family, of our parents. We model their behavior. And if they're negative toward us, that's what we learn. And that's how we learn to be. And that's how we learn to be toward ourselves. And when we grow up and become adults, we don't go, oh, okay, let me try a different way. We continue in that pattern because we simply assume it's the right way to be. We don't know any better. And most importantly, our brain literally develops neural circuitry based on those lessons. So we have an internal voice that can be negative, critical, and judgmental. And the way I train people to address this is to give them the qualities of a healthy internal parent. And the qualities of a healthy internal parent are love, coming from a place of love, compassion, acceptance, support, and care.
You know, a lot of people are in a relationship where their spouse nags. Why does somebody nag constantly?
Well, again, if you're growing up in an environment where that's something that you learn, it's normal and automatic for you to do it in your adult life and with the people you're with, because you think that's the normal way. You don't consciously think it, you just follow the way you were taught. And that's why one of my keys to resilience is a growth mindset, pillar number 5. And that's realizing that there's some lessons that you've learned that you have to learn differently as an adult.
And how about facial expressions? How important are they?
You know, it's interesting about facial expressions because they transmit what's going on inside of us. And we unconsciously pick up those signals. So someone that has a frown, we think, oh, there must be something wrong. Maybe I did something wrong. If someone has a smile, it makes us feel more safe and more comfortable. And this projection of our facial expression, the tone of our voice, is embedded in our evolutionary process. It's automatic. And so it's very important that we notice how we speak and how we approach other people, because it has an unconscious impact on others.
You know, in your book, there was a great quote. I love this quote by Maya Angelou, who is an American author, poet, I guess an activist as well. And what Maya said was that people will forget what you said, people will forget what you did, but they won't forget how you made them feel. Please go into that in a little detail.
Yeah, absolutely. And that quote comes from my 6th pillar, which is emotional balance and mastery. And, you know, a lot of times, particularly in our childhood, where we're not allowed or we don't feel safe enough to express all of our feelings, feelings don't go away on their own. And if they're not addressed, they get pushed down and they're staying there and they have energy to them. Emotions, in fact, motion is the root of emotion. And so we have this energy inside of ourselves that we've pushed down. And I believe that a lot of depression comes from people pushing down their emotions and literally creating holding patterns in our body. When you create holding patterns, it interferes with the flow of energy in your body. So it not only creates depression, but it also interferes with feeling positive emotions such as joy that require a full expression of your body. And so what's very important is to be aware of your emotional unfinished business. A lot of us carry these feelings of resentment, of anger, of sadness, and it's very important to pay attention, notice what they are, and work toward resolving these unfinished feelings, unfinished business. Sometimes we have them from feelings from childhood. Sometimes they're from yesterday or last month. And in my book, I go through a regular process of how you go through the process of experiencing, expressing, and then letting go of those feelings. Even if it's with someone who's no longer in your life, those feelings still need to be addressed. And so when you numb your feelings, it's very difficult to be fully expressive with other people. And that's what really makes connections between us and others, is how we feel toward each other.
Now, talk to me about the concept of toxic people and removing them from your life. Is it something that you should do? Will it make you better? Someone who every time you're around them, they're going to criticize whatever you say. They're going to argue with you about every word that you have to say. And when does it come to a point where it's time to say, look, this toxic person, I have to remove them from my life, so I worry about myself and not trying to please this person anymore?
Well, that's a very good question. And we come across people like this throughout our lives. And when we have a choice, it's always better to choose people who are more loving and caring versus people who could be critical and toxic. But sometimes we don't have the choice. You know, I say to people in my audience to discriminate those who are, say, toxic versus those who are healthy. And I get a chuckle in the audience because sometimes that person could be their mother, father, or somebody who they can't get away from, their boss, or someone that they work with. So first is to try and limit those interactions, those relationships. But when you can't, it's still important for a person to set a psychological boundary. And by that, I mean, I realize that person is negative, but I'm not going to let myself be affected by their judgments, their criticism. And I'm going to set this psychological boundary where those comments bounce off of that boundary that I set and go back to them. And so it's always our responsibility. Sometimes it means saying no to somebody when they're asking for something that really doesn't feel right to us. And a lot of times in my practice and with clients, I have to help them be strong enough to be able to say, no, I'm not going to allow you to talk to me that way. So this is very important. We want to limit the time with people who are toxic, negative. And when we're not able to, the first step is to give them feedback. Let them know how you feel and see if they listen and make adjustments, which would be ideal. And if they don't make the adjustments, then you either make sure you set that boundary or you limit your time with that person.
I have the instrument in my office, and I have to tell you, I am so impressed and how it could help many people. I have a passion for using the eye to be able to diagnose systemic disease way early, before even internists could diagnose it, to help save lives and prevent morbidities. So we're going to get to the instrument in a little bit, but let's give the audience a little background on glaucoma. And I'm going to start with a very difficult question. What is glaucoma?
Well, basically, simplistically, glaucoma is a plumbing problem. So the eye is filled with a microscopic fluid called aqueous humor. It's a clear fluid. And the purpose of that fluid is to supply nourishment to the tissues inside the eye. So inside the eye, we have a microscopic faucet, which is called the ciliary body. And we also have a microscopic drain, which is called the trabecular meshwork. The problem with all forms of glaucoma is that the outflow system, the trabecular meshwork, the drain of the eye, is impaired. That's the fundamental cause of all types of glaucoma, except a rare type of glaucoma, which is a vascular disease, which we call normal tension glaucoma. And all the current therapy is being directed at improving the function of that drain. So again, simplistically speaking, glaucoma is a plumbing problem. The drainage system, the internal drain, the trabecular meshwork, does not work as well as it should.
So that fluid that's being made by the ciliary body, the aqueous humor, it changes with circadian rhythm. So does it change with anything else? Does anything else, does diet affect it? Does poor sleep affect it, which may cause a circadian rhythm, stress? Anything else that you could think of that may also change it, or is it basically just circadian rhythm?
That's the most common fundamental cause, Dr. Gelb. And so typically what happens, that's an important point to make, is that the output from the faucet, the ciliary body of aqueous humor, is not constant. It tends to be highest first thing when we get up in the morning on awakening. And the production of aqueous humor, that clear fluid, is driven by a hormone called cortisol. So we get up first thing in the morning, our cortisol level is rising, our endocrine system is waking up, and that's when the output of aqueous humor is greatest in the morning. And that's unfortunate when most people who have undiagnosed, untreated glaucoma have those IOP spikes, which are damaging. So what happens when aqueous humor production, the clear fluid production, goes up, if the drainage system is impaired, the eye pressure will spike because the impaired drainage system cannot handle the increased production of that clear fluid. So there are other things that may affect it, but the number one cause that we have identified thus far is the production of cortisol, which increases when we first get up in the morning.
And how about exercise? How may that affect it? Because exercise may affect cortisol or metabolic syndrome. Somebody with the big belly that has all this inflammation, if the trabecular meshwork is inflamed.
Yes, exactly. Anything that's going to negatively impact the trabecular meshwork, like inflammation. There are other different forms of glaucoma where eye produces excessive amounts of pigment, where it sheds off the iris, and those pigment particles block up the pores of that drainage system. There's another syndrome that we call exfoliation syndrome, where the lens of the eye produces these little dandruff-like particles that flake off and then block up the pores of that trabecular meshwork. An important point, Carrie, Dr. Gelb, that people with pigment dispersion syndrome, where they're releasing that pigment, that tends to increase with exercise. You get increased rubbing of the pigment off the back of the iris with the lens, and that tends to block up the pores. And people with that heavily exercise, that have the pigment dispersion syndrome, where it's releasing that pigment, the IOP tends to spike during those exercise regimens that they do.
Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
OIE Broadcasting is the emerging leader in social media. We use scientific entertainment to drive more patients into your office. Visit oiebroadcasting.com and sign up today.